Hi guys, so I'm Kieran. I'm physio for One Zen Physiotherapy. Quite an experienced MSK practitioner. One of the most common things is lower back pain. So as you already know, watching this, most of you watching this would have had lower back pain issues at some point. We know that in the UK, at least 50% of the population at any one time would experience lower back pain and repeated bouts. For a lot of patients that come in to see me, it's often a case of I have lower back pain or repeated lower back pain. There's something must be crucially wrong. Can I have a scan to see if there's any issues there? Now, the issue with having or requesting a scan, especially like something like an MRI, is it may kind of cause a red herring effect. So we know that around anywhere between 70 to 80% of the population at any one time has a herniated disc. So this is my spine. So the disc refers to the intervertebral disc in between the vertebrae themselves. Now the disc itself is very fibrous, very strong, and can take a lot, to be fair. So when you herniate it, you can also unherniate it. I'm going to use that anyway. But we know that a lot of people do walk around with herniated discs completely pain-free, and they would never know the difference. It doesn't mean that the spine or the back is weak in any way. It's just one of those things that does happen and also does not happen. So what happens is you get an MRI scan, it shows herniated disc, L4, L5, L5, S1, and you suddenly think, you put the pieces together and think, that's why I have back pain. But actually, it might not be, because what it doesn't tell you is how long you've had that herniated disc for, or discs, and was that the actual cause of your back pain? It doesn't tell you that. Any scan is a snapshot in time of the back right then and now. So yes, you could have it, you could not. In the UK at the moment, within the NHS, they're very keen not to do MRIs, not because they want to waste time. Actually, they save a lot of time and save a lot of money by not doing needless MRIs. So we know that most lower back pain, around 95% of it, will respond to physiotherapy in the form of progressive loading, progressive exercise. So what we do as physios is we assess, diagnose probably the root cause of the lower back pain. We then give you very structured rehab exercises to reduce symptoms, i.e. pain, restore movement and function, and then progressively overload so it becomes stronger and more functional and builds your confidence up as well. So when you have back pain, technically the back is doing what it's supposed to. It's protecting, in essence, the only thing that's plugged into your brain, the spinal cord. So I would want my back to be quite sensitive to unaccustomed movement or loading that it doesn't really recognize or has been accustomed or trained for. So I'd want it to be oversensitive because it's protecting, in essence, a nuclear bunker. So I'd want my nerves around the area to be armed to the teeth. Okay, I want them to let me know if I'm doing something that it's just not used to or it doesn't look quite right. And then what tends to happen is those nerves respond by sometimes contracting the muscles around it, and most people will refer to this as a muscle spasm, and they go, oh, my back's locked up, I can't move, and it puts them out of action. But it's doing what it's supposed to. It's stopping you from doing what it is that was irritating the hell out of those nerves. And the key point is it's more than likely a nerve irritation rather than damage. We often associate pain and damage together, but the relationship is actually quite a grey area. In the acute stages of any injury, we know that pain and damage, or the initial insult, kind of go hand in hand, but the longer time goes on, the more they separate and come apart. And the longer pain goes on, the brain reorganizes that pain response in a slightly different way, so the relationship becomes really skewed. So if you've had lower back pain for a long period of time, and I say a long period of time, over 12 weeks, it's safe to say that the pain you're feeling isn't a representation of any damage or pathology in the back. Okay. And what we know is through rehab, through exercise, we can strengthen all the structures around it. So imagine these two joints here are facet joints. These get irritated, and when they become irritated, they might become slightly inflamed, irritates the nerves and reduces pain, reduces movement and improves pain and so on. So in essence, what we do with the exercise, we can help mobilize like that, rotate and so on, reduce those symptoms. And then when we're doing strengthening exercises, we're strengthening all the muscles around it, really to give it as the traction that it needs and the movement that it requires. We also have a fantastic mechanism in the body called exercise-induced hypoanalgesia, and all that means is you can do a certain intensity of exercise to reduce pain-related symptoms. Okay, runners already know about this. Runners will call it the runner's high, but it's really meeting a very certain intensity to induce those natural endorphins. And remember, endorphins are in essence natural morphine within the body. So that's what we're doing with that. So we're controlling that pain response through the exercise. We're sending positive messages back through the nervous system to say that we're good. There's no damage here. We're good. We can move. We can groove, and you'll find that movement restores from that. And we tend to give exercises that are relevant to you, the individual, and meet your goal, purely because it gives you a lot of tools for your toolbox. So say, for instance, you then have a reoccurrence of lower back pain for whatever reason. There's lots of reasons why. It, again, doesn't mean that there's consistent damage there. What it means is, again, you've done something that's irritated that nerve. It's up to you to then problem solve. How did I do that? How can I not do that again? So with the exercises, we give you those tools. Ideally, we then want you to say, do you know what? I'll do this mobilization exercise. I'll do this strengthening exercise. I've reduced symptoms myself. I can move on. Brilliant. Because what happens is it empowers you, and you'll find that recovery becomes quicker and quicker to the point where you're just fine. Recognize lower back pain for what it is, especially when it's local back pain. It's a nerve irritation. If you irritate the nerve root, that's when you generally get symptoms going down your leg. I know the word sciatica is thrown around quite a bit, but sciatica refers to a very specific condition with pain traveling down the back of your leg, anywhere from the back of the knee to the foot. And when you irritate that, you get what we call a radicular pain. So you get sharp shooting pain down your leg, pins and needles, tingling, numbness, hot and cold, temperature change, or the sensation of. All of these are normal within a nerve root irritation. Again, it only accounts for about 5% of all back pain is radicular pain. And even then, we're just ever so slightly more cautious because you have what we call high irritability, so we can trigger symptoms quite easily. But the exercises will be very similar, and it is always exercise related. You can do manual therapy, you can do soft tissue work, massage, all will be really useful and feel quite nice. But with any kind of physiotherapy, how I would do it, if I give you any manual therapy, I would ensure that you understand that I'm just creating an open window. So I'm creating a lull in the pain, I'm improving your function, and it will be temporary at first. Use that window to then do the exercises to enhance what we're doing and build that foundation. And that's really how it should work. What shouldn't happen is you do the massage or manual therapy, bye-bye, see you later, go away, because inevitably the pain will return, you'll come back, and we'll go around in this cycle for a bit until you inevitably automatically heal, or you don't. And you see this a lot in other kind of medical professions, but I won't name names because it's not what this is about. But you'll find that they do their given modality, then you're just told to go away, or you do a couple of stretches, They might do something, they might not, and then you come back to them. Okay, it should be more of a holistic approach. Manual therapy, create an open window, reduce pain and symptoms, do the exercises. When you come back, that improve symptoms, pain's decreased a little bit, movements increased a little bit. Okay, let's then do the same, but progress the exercises on, and so on and so on, until you get the result you want. Now, that is a very long-winded approach to why you may get back pain and what to do about it. It is multifactorial. It isn't an easy answer because it is so widespread and it's very belief-driven. If you believe that you've got damage in your back, then you've got damage in your back. It's my job to educate you, no matter how challenging that may be sometimes, but it's nevertheless the truth. I hope you found this useful. Please share this amongst others if you know that they have lower back pain. Remember, it's probably 50% of your friends statistically. If you have any questions, then please, if you're watching this on YouTube, leave some comments or questions. If you're watching this on any other modality, then please go to our website, which is onezenphysiotherapy.co.uk, and message me there. Thank you. Bye.